Well, it's the fall. And this fall, we have a few things to be concerned about when a person gets ill respiratory-wise. Is it the flu? Is it the common cold? Or is it COVID-19? And can you tell the differences symptomatic-wise between these three different respiratory illnesses? Let's talk about that. So let's talk about the common cold. Well, you know the common cold, there's over 200 viruses that can cause the common cold. And typically rhinovirus and coronavirus, a different kind of coronavirus, causes the majority of the common cold symptoms. And these, the way these are spread is if a person coughs or sneezes or sings, laughs loud, and these respiratory droplets are transmitted or spread to another person through their mouth, nose, and sometimes even their eyes. And so that's how these viruses are spread from one person to another. And of course we know they can travel. We saw in previous videos where they can travel up to 6 feet. That's where we came up with the 6 feet of distancing. But we also found out that they can travel up to 12 feet. And with COVID-19, it can be aerosolized and go 27 feet. And so when we're talking about these viruses and how they're spread, we need to keep that in mind. And also the other way viruses are spread are through contact with hard surfaces that we may come in contact with, like door handles and tables, cabinets. And that's why it's so important to keep washing our hands, constantly washing our hands. So based on the symptoms with the cold, flu, and COVID-19, can you really tell them apart? Let's look at the cold. The cold symptoms typically are sneezing, runny or stuffy nose, sore throat, or cough. And typically with the cold, the person is contagious within the first 2 days, even before the symptoms start. And the cold symptoms these symptoms usually last about 5 to 7 days. And some people can have a cough that will go on for days to weeks. But typically the brunt of these symptoms will last about 5 days. And the person is contagious within those 5 days of having those cold symptoms. When we look at flu symptoms are very similar to the cold symptoms, although the patient will talk about experiencing muscle aches and pains, as well as fatigue, and also they'll talk about a headache that they have if the flu is the culprit. The common cold and the flu are very similar in symptoms. However, we see the flu has a few other symptoms that make it more, separates the two of them out a little bit better. And remember, with the influenza virus, the day the person contracts the virus, that's the day that they can spread it. And their symptoms, a person that has the flu, their symptoms will start about 2 days after they've actually contracted the virus. And those symptoms will last about 5 days. We know that with the flu, you get hit hard with the fever and the muscle aches and the sore throat, and then after about 5 days, you're better. When we talk about SARS-2 or COVID-19, the symptoms can range anywhere from no symptoms at all, but the person can still be contagious. We know that about 40% of the people that have COVID-19 are asymptomatic. They don't have any symptoms. And then you have patients that have mild symptoms, and then you can have people that have moderate symptoms, and you can have symptoms that last long, many days to weeks. And so with SARS-2 or COVID-19, the symptoms and how long they last are very unpredictable. But we do know that there are patients that are at risk. Age, patients that are over 65 are at a higher risk. Males, obesity, diabetes, hypertension, and high blood pressure. So we know those are risk factors for COVID-19. And also there was a study published in October in this month in the New England Journal of Medicine that showed that people that were blood type A had a higher risk for contracting COVID-19 and that their symptoms were worse. Having blood type O gave you some protective protection against this COVID-19. They also found in this same study that there's a cluster of genes that if a person carries, that also puts them at a higher risk for COVID-19. So the most concerning symptom though with COVID-19 is that shortness of breath. I mean, if a person starts to have shortness of breath, obvious shortness of breath, and you have one of those little oxygen readers that can tell you that your oxygen is up or down, that can be very helpful. We know that typically people, their oxygen runs about 98 to 100. People that have lung disease or chronic smokers, their oxygen runs about 94. So baseline. So if you check if you start to have shortness of breath and you have that little oxygen reader and it's reading low, like in the 80s or low 90s to high 80s, we know we're heading for a problem. So that shortness of breath with the COVID-19 is a real symptom that we need to take heed, and you may need to then go to the emergency room or contact your doctor. The other symptom that's real specific to COVID-19 in most cases is the loss of taste or loss of smell. And so we want to be watching for these symptoms as we go through this season. Can you tell the difference? Sometimes you can, but the best thing to do is to contact your primary care physician or your provider and let them know what you're going through early on instead of waiting. I know we all like to do our home remedy, but in this season it would probably be better if you contact your provider sooner than later. How can we tell? I mean, is it the common cold? Is it the flu? Do we have COVID-19 and then we just have mild symptoms? Well, the only real way that we're going to be able to find out is by doing these tests. So with the flu, there's a rapid antigen test. It's 70% sensitive, and so it's a pretty good test for telling if you don't. It's 70% correct in terms of identifying a person that is positive for the flu. 70% is not good. We want to get closer to 98 to 99. But in terms of if a person is negative, if they take this test, it's a pretty good indicator. It's up in the 90s. So if it's negative, if you take the rapid flu test and it's negative, then there's a 90+% chance that you don't have the flu. There's another test that you can take, the standard flu test. Of course, it takes 3 days before you get the results, and then the time factor there can be a problem. So that test isn't used that much. With COVID-19, we have the PCR test, which is the nasal swab or the throat swab. We have the rapid test, COVID-19 test, which is pretty sensitive. It's about as good as the PCR test. And so that rapid test where you get the results back in 15 minutes is a pretty good test in terms of telling you whether you have COVID-19 or not. And then the third test we talked about in the earlier video, the antibody test, which actually just tells if you have antibodies if you've been infected by or if you contracted and been infected by COVID-19, and if your body has mounted antibodies against the virus. So there you have it. There are some times there are some things that you can look for when you're trying to tell whether you have a common cold, or if you may have the flu or COVID-19 and it's time to call your doctor. Let's take heed to those, and then also continue, by all means, continue to wear the mask, wash our hands, and I would also say that if there was ever a season that you would want to take the flu influenza vaccine, this would be the season to get that flu vaccine to minimize the chances of you having the flu. So if you like this video, click the like button and subscribe to this channel for more information. Thank you.